to scapular retract and or not. Today is that topic. I'm Dr. Evan Osar. Thanks so much for joining me here at Integrative Movement Insider. And in this edition, I'm sharing with you the perspective of training and how to look at training a little bit differently with your clients, and really how it's all about perspective or the context of how you're using your information. If you've been following us, thank you for following us. If you have been a long-time follower, and if you're a new follower, thank you for being part of our community and allowing us to share this information with you. You've heard me talk a lot about scapular retraction, and oftentimes I'm talking about not to scapular retract during exercise. Here's a perspective of why I say that, and here's a perspective of sometimes when you may need to have scapular retraction as part of your client's component. One of the reasons I often teach not to scapular retract is when our arm is going out here in front of us, so this direction, and or overhead, so reaching overhead and or doing overhead type movements, whether it be a pull up, pull down, and or pushing type movements, we need the scapula to protract, actually move into upward rotation and posterior tilt. With excessive retraction or dominance of the retractors and or depressors, we'll limit that motion. The more we limit that motion, the more the individual will have to compensate by overly elevating the scapula, which is another common cause of why clients will scapular or elevate their scapula. Another common issue is the more we teach our clients to retract and or depress, we can develop dominance. Because remember, like, there's several things pulling the shoulders down. One is gravity, one is the weight of the shoulders, and one is just a contraction of muscles. For many of our clients, especially people who are shoulder grippers, people like myself who've been taught to stabilize and really pull the shoulder blades down and back, we've already overtrained that component. Adding gravity, adding excessive load of things we're carrying, things we're doing in the gym, we can actually bring the shoulders too far down. I was just working with a fellow fitness professional, awesome dude, who's developing some cervical issues. Now he's got significant weakness in his hand and or upper extremity. That's one of the things that leads to those issues, is when we overly retract and depress. So what's happened is the scapula is sitting too low, and what happens is it starts to overload the neck, and then those cervical discs. C5, 6, 7 are common areas for disc herniation, and now he's got some weakness in that side, some scapular winging, and some issues with his actually hand strength, his grip strength, when it gets too significant, and it's impacting those cervical nerves. So those are the reasons why we teach not to scapular retract, is because we need that component of posterior tilt, upward rotation. The more we retract and depress, the less the client is able to do that. Now, there are some situations where you may need to have your client scapular retract. And this is a very important concept as well. What we want our clients to do, especially those clients with forward shoulders, so now take your older client, many of us train older clients, myself included, they're more kyphotic and their shoulders are forward. Well, you may need to do some scapular retraction just to get the scapula to come back to a more neutral position. So the concept here is retracting back to a neutral position, a more optimal starting position, so that then they can start to train the upward rotation and posterior tilt of the scapula, or this motion of the scapula. Don't worry about the word so much. Just think about the optimal motion of the scapula moving flush up against the rib cage as they're moving. So the retraction is really just to train the client to get back to here, not to excessively squeeze the shoulder blades down and back and try to maintain them there, because again, that will disrupt optimal mechanics of the shoulder. So if you are having your clients train retraction and or depression, watch the mechanics, watch their scapular mechanics, watch their overhead motion once they've done that. Are they maintaining that ability to keep the scapula in a good position and maintain that both the concentric and the eccentric control? Because if the cue helps them, not does it look better, but it does it help them, which also looks better, but it's more important about the movement and the control. If it helps them move and control that motion better, then scapular retraction may be a good cue. But it's all about what your client is doing, not just saying randomly, hey, here's a cue, just do it because your shoulders are forward. Because that will oftentimes, as I mentioned, it'll just, if they're downward rotated and anterior tilted, so they're in their forward shoulder position, and they just retract and they don't get the ability to get their scapula into posterior tilt and upward rotation, then they're just retracting themselves right back down into a non-optimal position. So what do we teach our clients to do during rowing type positions or pulling type motions? I'll set myself up, I'll turn my back to the camera. So basically what I'm doing is having my client set up so they have a long spine, they have width across their shoulders, they have a bit of scapular activation. It's not this, it's not pulling the scapula together and or down, it's just, okay, activate in that position. So it's wide shoulders, activate in that position, and now I'll teach them the row. So if I grab some weight here for like a horizontal cable row, scapula are slightly retracting, scapula are slightly protracting as I go through the eccentric, retracting slightly, protracting slightly, but remaining in control. So it's not this, it's not excessive protraction, it's not excessive retraction. It's teaching the individual how to control the scapula through the horizontal eccentric motion and the concentric motion of the pattern. So that way, we're teaching the client to maintain, the exercise is helping them maintain the position. They're moving this way and this way, they're just not doing this. They're not excessively retracting, they're not excessively protracting, okay? So a high to low pull, very similar. So what we're going to do here, same idea. We're going to long spine, set the scapula, maintain the scapula. As I pull, it's slight retraction and depression. And as I let the arms go back up through the eccentric phase, it's slight protraction. But again, it's not this, and it's not this. It's somewhere in the middle where the scapula are allowed to move. But if you look at me, it doesn't look as if they're moving because I'm not allowing them to lose control during the eccentric and or excessively retract and depress during the concentric. So the work for your client is to maintain this position as the arms are moving. And that's the challenge for most of our clients, is that stabilization strength, the ability to, can I hold my scapula in a relatively neutral position and allow them to move through the normal mechanics so that we're reinforcing the activity of all the scapular stabilizers. So it's not really about just the retractors and depressors, it's all the muscles around the scapula. Are they doing their job to maintain that alignment and control? And that's how you help your clients develop healthy shoulders, a healthy neck, and not overload structures like their discs or their rotator cuff and or their labrum of their shoulder, which can lead to so many of our chronic issues. I hope that made sense. So again, the perspective I want you to take from this video series is there's a time and place to retract and or depress, and there's a time not to. And the cue that you give your client, it's always about, is this cue the right cue for your client? Is it helping to, number one, improve their alignment? Number two, help them maintain their alignment and their breathing. Number three, do they have the right control as they go through the movement patterns? Or are they constantly just going retraction, depress, and protract and elevate? And they're not really developing the ability to control that movement. And that's really what we teach as part of the Integrative Movement Specialist Certification Program, is not just the foundation, because the foundation, the perspective is the foundation, but you get the perspective from understanding functional anatomy, how the muscles and joints work together, that's sort of biomechanics as well, but then also the motor control. How is the brain supposed to be controlling the nervous system, controlling movement? And there are some certain ways that we can teach our clients to achieve more optimal movement. Again, we're not trying to make our clients perfect. We're just trying to help optimize their posture and movement strategy so that they can use it more effectively when they need it out in the everyday world, when they're playing with their kids, when they're doing their activities in their yard, when they're doing those functional movements that they need to do, like squatting, bending, lifting, turning, and doing all the fun things they want to do, like play pickleball. Pickleball is a big sport now, so I'm trying to get into it myself. So that's the purpose of the integrative movement system and the process we work our clients through. And health and fitness professionals, just like you, we work you through understanding the perspective and then giving you the tools, the foundation first, and then the assessment tools to understand what you're looking at when you evaluate your client's movement, as well as how to help your clients develop, or I should say, choose the most appropriate exercises, as well as the most effective strategy for helping them improve their posture, their movement, and ultimately integrate this into the fundamental movements. So again, pushing, pulling patterns, horizontal, vertical patterns as well. So that way you are reinforcing the work that you're doing. That way your client's learning, ingraining these patterns and habits into their body, and then they can take them outside of your session to everyday life. If this sounds like good information, and you enjoy this information, and you're looking to learn more, then click on the link below this video or next to this video, wherever you're watching it. Enrollment for the 2023 program is now open. It's an intensive program. It's a year-long intensive program. We've condensed it into probably about a little bit more than 10 months. we take you through the functional anatomy, biomechanics, motor control, so you have that foundation, so you have the perspective. Then we take you through how do you assess, and we have you go through case studies, and we guide you through, we coach you through case studies, so that way you're using this information right away with yourself and your clients, because it's important that you use this information with yourself. We take you through the trunk, spine, and pelvis, the core, the pillar of the body. We take you through the hip, knee, ankle, and foot, so you understand those mechanics, the assessments, the corrective exercise strategies. We take you through the shoulder and upper extremity, the thorax, how the shoulder and thorax and head and neck relate to each other. And we are constantly giving you feedback, homework. You're doing it on yourself, you're using it with your clients, so that way we're coaching you through the entire time, so you're getting real-time feedback on the information, how to use it, how to apply it to the clients that you're already using, and the information that you're already using with success. So we're not trying to change what you do. If you're Pilates, if you're functional training, if you do even CrossFit or group fitness or coaching, we're not trying to change what you do. We're just trying to add that perspective so that you feel more confident, so you can attract more individuals, because there's so many people that are struggling with chronic tightness, discomfort, and just not being able to perform at the level they need to and or want to. So if you think this program is for you, or you want to find out if this program is for you and the clients you serve, click on the link. We'd love to set up an interview, or not even an interview, it's more a discussion to see if the program is right for you and if you want to join us for 2023. I know that this program can change your perspective. It will change your perspective. It can really enhance everything that you're doing and really help you understand why some of our clients struggle, even when you're doing all the correct or right things, or the ideal movements with your clients, why some of them still struggle, and give you some strategies and techniques that we use every single day with our clients in our clinic and with the people that we serve. So look forward to seeing you. This is Dr. Evan Osar with Integrative Movement Insider. Again, thank you for allowing me to share this information with you. If you have any questions, feel free to reach out. Happy to answer, happy to support you in any way that we can. Can you continue to be that leader for your current clients and be the light for those who are looking for someone just like you to help make their day a bit brighter and to help them move with more optimal posture and movement. Take care.